A new COVID-19 variant is catching the eye of scientists across the country.
It is a subvariant of Omicron. It's called BF7.
And outside of communities seeing high transmissions, the CDC says nursing homes and hospitals no longer need to require masks. Lots to discuss, as always, with UW Health's Dr. Jeff Pothof. Welcome back.
Hi, Dr. Pothof. Good to see you.
Let's talk about the masking situation.
Sure.
First of all, UW still requires masks, even though the CDC said it's okay not to.
Right. So when the CDC says this, they are looking at transmission levels of COVID-19 in communities. Now, this is different than the map that a lot of us use to determine if you need to wear a mask to go to a grocery store. This looks at cases per 100,000 people. And we need to be in kind of that moderate low range, ideally, to pull away those masks. So that's about 50 cases per 100,000 people. Right now in Dane County, we're just under 300 cases per 100,000 people. So
within the hospital system.
Within the county, which then suggests that if we were to not mask, we would have a fair number of visitors and staff coming to the hospital with COVID and then potentially passing that on to our vulnerable patients. So I don't think you'll see any change in masking guidance in the health systems in Dane County or really anywhere in the state of Wisconsin right now, but there are places in the country where COVID levels are to such a low extent that the likelihood of someone coming into hospital with COVID is low enough where the hospital staff wouldn't necessarily need a mask.
But no health checks. I mean, you just need a mask. They don't stop and take your temperature anymore.
No, none of that.
Because the community transmission in Dane County is considered low right now, right?
Right, it's considered, it's this moderate level, so it's this yellow, which would mean that if you're healthy, you could go out in public in groups without a mask. And the difference between that metric versus what hospitals use is in public, you're typically not hanging out with a whole bunch of people who are having chemotherapy, had liver transplants, and all these other things that make them more susceptible. So the bar is higher for healthcare systems than it is for the general public.
Let's talk about this new variant, BF7, is it?
What is it?
Yeah, BF7.
I can't keep up.
It's at least showing up on the chart. So within the United States, by far, the most cases of COVID-19 right now are caused by BA4 and even more so BA5. There's this BF7 variant, which is making up a bit under 2% of cases in the United States. So not to the point where we're, particularly worried about it, but, it's hanging in there. It's been there for a couple weeks. We'll keep an eye on this, but too early to say whether that's going to turn out to be anything or not.
It takes a while, doesn't it, before you can figure out how transmissible it is?
It does. You need to, do enough sampling so you can see how quickly is this one taking over or is it not taking over. It's just a variant that's out there, and sometimes these burn out, especially if they can't compete with what we know are the most contagious variants right now, that BA4 and BA5.
How are the numbers for the new booster for the BA4 and 5?
Yeah, we don't have new data yet. What we understand about those boosters is when you look at antibody creation, when you get that bivalent booster, about 8 times higher against Omicron, BA4 and BA5 compared to the original booster. So that likely affords some sort of benefit, but whether that means less severe disease or even less likelihood to develop symptoms, we don't have that data yet. Probably another 30 to 60 days before we can get enough samples collected where they say, hey, this is the actual benefit to someone who gets that.
And get a flu shot.
Yeah, flu shot looks like it's going to be a good choice this year. Things were a little bit rough in Australia this year, which suggests our flu season going to be a little bit more rough here too.
Are people getting the new booster? It seems like the numbers aren't very high.
Yeah, I think it probably depends in the circles that you go in. Certainly within the healthcare environment, yeah, absolutely, we're all getting that bivalent booster. I think other folks, COVID numbers are low. It doesn't probably seem as pressing, but as the days get shorter and the weather gets cooler, a good idea to get that done.
Anybody over 12?
Anybody over 12 who hasn't been boosted in the last 2 months.
Okay. For Pfizer, Moderna is still 18.
Yep, Moderna is still 18, and we may see these vaccines approved for those younger kids sometime in the next 2 to 3 weeks.
And you see, maybe there is some benefit of switching brands.
There could be. There's some small studies, not conclusive evidence, that if you switch brands, you get increased durability. That protection lasts maybe a little bit longer before it wears off, like we saw before.
All right, shots for everybody. Roll up the sleeves, all of them.
There we go.
All right.
Thanks, Dr. Pothof. Great to see you.
We'll see you next week.